Well, there are numerous benefits of electrophysiology. What we have seen is the biggest thing is probably earlier detection. We've got all these different tests that we use in eye care, and from visual fields to OCTs, and some of them look at structure and some of them look at function. But a lot of the limitations of other testing is the patient has progressed into the disease state a pretty significant amount, where we now have the ability to detect when cells are struggling, when they're not dead but they're dysfunctional, and the ability to detect that dysfunction and a disease state at an earlier process has been an incredible thing in our clinical practice.
We've had the Diopsys Nova system since about 2011, and we have several cases where we've been able to diagnose glaucoma much earlier, manage the disease at a much earlier state to preserve a lifetime of healthy vision for that patient. Once we were able to incorporate the electroretinogram, the pattern ERG, into our system, we're having even earlier diagnosis of glaucoma, as well as many macular conditions such as macular degeneration and diabetic retinopathy, so that we can actually diagnose earlier, treat earlier, and really have a lifetime of healthy vision for that patient.
Pattern ERG has, in the last couple of years, been recognized as a very effective tool for early diagnosis. There has been a paper that was released by a major institution, Bascom Palmer, that demonstrated that pattern ERG detected dysfunction in potentially glaucomatous eyes 8 years ahead of the structural evidence for that disease. So there's a wealth of evidence that talks about early diagnosis, not only in glaucoma, but other maculopathies.
We're learning that these are sick cells. And by using electrodiagnostics, we could detect the sick cells, treat the condition, going back to glaucoma, address their condition and address the IOP, and we get those sick cells functioning into healthy cells. And so that's the benefit, because we know with glaucoma, once you lose your vision, there's nothing that we can do to get your vision back. And so early detection is going to be key. Detecting the early signs or the sick cells is going to help us in our treatment and keeping our patients seeing.